Okay, I think we'll make a start. Thank you, everybody who has been logged in early. Thank you for your patience. So good afternoon. Thank you for attending our webinar on hair, drug and alcohol reporting, your options and frequently asked questions. I'm Liam Feasey. I'm the Client Services Manager and a Reporting Scientist here at Lextox, and I'll be delivering today's webinar. Before we start, just a bit of housekeeping. All attendees have been set to mute. This is to reduce background noise and to ensure you can all hear me clearly. This is a live broadcast, so unfortunately we won't be taking any questions during the webinar. However, if you do have any questions, please feel free to email them to us at experts@lextox.co.uk, and we can then send a response back to you accordingly. Today's webinar will last for approximately 20 minutes and it is being recorded, so we'll share the recording with you post the event. Okay, so let's begin. So today's webinar, we're talking about hair, drug and alcohol reporting, the various options available to you and some of the frequently asked questions. So I'll go through and detail the certificates of analysis and then explain what's included in an expert report. I'll then summarize the key differences between the two and then go through some of the frequently asked questions our experts here at Lextox get asked and that we're called to raise responses to accordingly. Then we'll go through understanding the results and then just a quick conclusion towards the end. Okay, so a quick introduction. So all of the hair, drug and alcohol analysis results that we provide are issued in either a certificate of analysis or a CMA or an expert report. And an expert report is something that we'd really recommend that you have, and we'll go on to explain these reasons throughout the webinar. So the hair analysis is undertaken and the reports and the results are prepared at our own ISO 17025 UCAS accredited laboratory based in Cardiff. The analysis that we undertake is in accordance with the Society of Hair Testing internationally agreed recommendations. And our experts here, and myself included, are members of the Society of Hair Testing. So we help to devise the consensus and the recommendations, and we feed into the recommendations set down by the Society of Hair Testing. All the results and expert reports are legally defensible and are issued on average in 4 working days of receiving the sample into our laboratory. So if we receive a sample in on a Monday, the result will be issued to yourselves by the end of the week. Okay. So first of all, a certificate of analysis. So this is the type of results that you get, which is included in the cost of the analysis. So there isn't an additional fee for preparing a certificate of analysis, and it comes as standard. So the C of A will list all of the drugs and analytes that you have instructed us to look for in the hair sample. And it will give you a level of the compound, the drug or analytes detected. So it will therefore state if it's detected or not detected. Now, within the certificate of analysis, it will state the approximate time period covered by the hair analysis, and more importantly, each individual section that you've asked us to analyze. The certificate of analysis is accompanied by a covering letter, which just gives a summary of the analysis results. But you don't get a full interpretation that you would do with an expert report. Included in the covering letter of the certificates of analysis, we can include a photograph or an image of the donor that was taken at the time of the sample collection. This can be used for identification purposes if other ID hasn't been able to be provided. So as part of our standard procedures, certificates of analysis are reviewed and issued by our own expert scientists and reporting scientists based at our laboratory. As I said, there's no interpretation of the results provided with the certificate of analysis. However, further questions can be asked on the results if the certificate of analysis is issued. However, if we do receive questions, this can be chargeable, and this charge is in accordance with the legal aid codified rate. Alternatively, an expert report can be requested at a later stage after the certificate of analysis has been issued. However, this is chargeable, and again is in accordance with the legal aid codified rate. The alternative for issuing the results is having an expert report. So this is issued by our own team of laboratory-based experts and reporting scientists who have over 50 years combined experience of working in the hair, drug and alcohol testing industry within the UK. So the reports contain several pages about the analysis and an actual expert interpretation to help you and the court understand the analysis results. The expert report also goes through the chain of custody and considers case-specific information such as the use of medications and any hair treatments that may have been declared by the donor at the time of the sample collection. In respect of any hair treatments, we also make our own observations at the laboratory, i.e. we examine the hair to see if there's any visible dye lines along the hair or any colour changes along the hair sample, or if during the laboratory extraction process we observe a colour change, which can all be indication that the hair has been chemically treated, i.e. dyed or bleached. So we would also include these observations that we make at the laboratory into the expert report as well, and consider these in our interpretation. Now, the expert report provides a summary of the scientific findings, a receipt of the items included, and it provides a table of the results and a conclusion of what those results mean and our interpretation of those results. Now, an expert report is issued within 4 working days on average, and the report is prepared in accordance with the legal aid codified rate. They are legally defensible and accepted in every UK family court. Now, if there's any questions on the analysis results or any of the interpretation in the expert report, you are able to contact us and we can clarify those questions for you. And our reporting scientists are all court trained, meaning that following receipt of the results, they're able to attend court to explain the testing results if required. Okay, so some key differences between the 2 different types of analysis results that you can expect to receive from us. So both the certificate of analysis and the expert reports are issued by our experts, our own in-house reporting scientists who are based at the laboratory and have access to all of the laboratory records here at the lab. They both detail the actual analytical results, i.e. the level of that drug or analyte that's been detected in that section of hair. Both of them include the approximate time period which will be covered by the test or each section. And if necessary, both of them will include a photograph or an image of the donor that was taken at the time of the sample collection for identification purposes if other ID hasn't been provided. Now, the additional information that you get with an expert report is that you do get an interpretation of those results, and you get our opinion as experts who have been working in hair, drug and alcohol testing for a large number of years on what those actual analytical results mean. The expert report also considers case-specific information such as medication, hair treatments, and also provides a glossary of terms to help understand some of the technical terms that are used within the expert report itself. Okay, so moving on to some frequently asked questions that are often posed to our experts for us to prepare a response accordingly. So the first is, how soon after use can drug and alcohol be detected in a hair sample? Okay, so this is quite important, and I'll explain the significance of this. So it takes approximately 2 weeks for hair to grow sufficiently above the scalp for it to be included in the actual analysis. Now, this is because when a drug or alcohol is ingested, it goes into the bloodstream, and the blood therefore transports the drug around the body. So as the hair is growing, any drug is incorporated into the hair itself, and then the hair actually then has to grow out of the scalp or out of the body to then actually be cut and actually included in the analysis itself. So therefore, we allow 2 weeks from ingestion to go into the bloodstream, into the hair, and the hair to grow sufficient length out of the body or out of the scalp to be cut. So we always take 2 weeks off from the sample collection date to account for this 2-week period. Now, the significance of this is that if you're looking to cover a specific time period with the hair test, you do need to take into account this 2-week period. So say, for example, you wanted the hair test to cover the whole period of March. You need to organise the sample collection during the middle of April so that we take 2 weeks off so that we can cover from the end of March backwards. Okay. So because of this, hair analysis isn't appropriate for recent use, i.e. trying to establish whether somebody's consumed drugs within the past few days or the past few weeks. The timeline provided with a hair test is in months only. You can't say something happened in the past couple of days. Scalp hair grows on average of approximately 1 centimetre a month. So the time period that we can actually cover with a hair sample is dependent on the head length of the hair which is available. If the hair is 12 centimetres in length, we can cover 12 months up to a year. But we would have to break it down into smaller sections, i.e. 1 centimetre sections or 3 centimetre sections. We wouldn't be able to analyse the full 12 months as a whole because that can actually compromise the sensitivity of the test. Okay. But the approximate time periods of the hair collected is detailed in the expert report. Now, the time periods that are provided are beginning, middle, or end of the month, i.e. from the beginning of March to the beginning of April. Now, the way that the beginning, middle, and end is calculated is that the first 10 days of the month is assigned to the beginning of the month. The middle 10 days of the month is assigned to the middle of the month, and then the end 10 days is assigned to the end of the month. Okay. Okay, so another common question we get asked is, my client denies drug use. Could there be another reason for the positive result? The test that we do at our laboratory uses liquid chromatography with tandem mass spectroscopy and gas chromatography with tandem mass spectroscopy. These are very sensitive and specific confirmation techniques. So when, for example, a drug such as cocaine is detected, it can only be cocaine and it can't be any other substance. So any other drug or any other medication wouldn't give a false positive for the drug that we found. If we find cocaine, it can only be cocaine. Low levels of drugs can be detected due to the regular passive exposure to a drug in an enclosed environment, i.e. so this is somebody being in an environment where there's drugs in the atmosphere and the individual being exposed to that drug on a regular and frequent basis in an enclosed environment. However, we do have measures to minimize a positive result from passive exposure to a drug. The first is that we wash all hair samples and all hair sections prior to analysis. So this removes any traces of drugs on the outside of the hair. So what we're analysing is what an individual has ingested and incorporated into the hair. Secondly, we apply cutoff levels. So the cutoff level is there to show the repeated use of a drug. And the third, we look for the metabolites. So a metabolite is a substance which is produced by the body upon ingestion of the drug. So when somebody takes a drug, the body breaks down that drug to eliminate it from the body. During that elimination process, the body is breaking down that drug and it produces other substances called metabolites. So therefore, the presence of a metabolite helps to confirm the use of that drug. So we do have measures in place to prevent a positive result from passive exposure. Okay. So there are a number of potential influences that can affect the level of drugs and alcohol markers that we would actually see in the hair itself. The first is the effect of hair bleach and hair dye. So any sort of chemical treatment to the hair, such as bleaching, dyeing, can damage the hair and can leach out to any substances which are trapped inside the hair itself. So the application of hair dye and bleach can lower the levels of substances that would be in the hair than if the hair hadn't been chemically treated. Now, we can still undertake the analysis on chemically treated hair. The analysis is still accurate, it's still sensitive, it's just that the levels detected would be lower than if they hadn't chemically treated their hair. If somebody was a low-level user of drugs and they did bleach or dye their hair, it could produce a not detected result. If they're a regular user of drugs, it would just lower the level. Okay, so it is something to be aware of. And as I said earlier in this webinar, we do make our own observations to identify if there's been any evidence of hair dyeing or hair bleaching at the laboratory if it isn't declared at the time of the sample collection, and we do include our own observations in the expert report. Okay, so hair products such as gels and hairspray and how this can affect alcohol. With the hair alcohol testing, we're looking for two markers. One's called ETG, which is ethyl glucuronide. The other is FAEE, which is fatty acid ethyl esters, and the particular one we look for is ethyl palmitate. Now, ETG, it cannot be affected by the use of products containing alcohol, such as hairspray or gel. It can be lowered by dye and bleach, but it can't be elevated through the use of products containing alcohol. Whereas the other marker, ethyl palmitate, can be elevated through the use of products containing alcohol, such as hairspray and hair gel. But it's a particular alcohol that needs to be included in those hair products, and this is ethyl alcohol, which is often labelled as alcohol denate or ethanol on the ingredients. Now, if we do have a result where we have a positive FAEE and a negative ETG, we would interpret that as may have, because the may have consumed chronic excessive alcohol. This is because the FAE could have been elevated through the use of hair products. So in these instances, what we do ask our clients is them to send through a photograph of the ingredients of the products used. We can then look at these ingredients to see if it contains the correct alcohol, which can elevate the FAEE level. Okay. Passive smoking and external contamination for drugs. We've already covered that on my previous slides. So we do have measures in place to prevent a positive result from passive exposure to a drug. As I said, it has to be in a regular and frequent basis and in a confined environment. Okay. Medications for drugs. As I said, the test that we do is very sensitive and very specific. So if we see that specific drug, it can only be that drug and it can't be anything else. We do ask at the time of the sample collection for the donor to declare any medications. We do this so that we can include this in interpretation and rule out the effect of the medication in our interpretation. Some drugs such as codeine, which falls under the opiates drug group, can be purchased over the counter. So if they declare the use of codeine, then if we found codeine, then it helps to verify the declaration of codeine, for example. The concentration and the purity of the drug taken, the drugs, can impact on the level that we actually see in the hair. There's no pharmaceutical regulations on how illegal or street drugs are actually prepared. So the purity of the actual drug can vary from individual to individual that has been purchased or obtained. For that reason, we can't state the level that's found in the hair to be back calculated to an actual dose used of the drug, because the purity can vary. Okay. And more recently, we've been asked about the effect of a gastric bypass on the hair alcohol test. Now, our expertise is in the detection of drugs, metabolites, and alcohol markers actually in hair, and the interpretation of those results. However, we conducted scientific research to determine how a gastric band may affect how alcohol is broken down by the body. So it's our understanding that some alcohol is initially broken down in the stomach before it actually enters the bloodstream. So therefore, the longer the alcohol remains in the stomach, the less is absorbed into the blood. Therefore, it could be a lower blood alcohol concentration. In individuals who with gastric bands, the size of the stomach is significantly reduced. Therefore, the time spent by alcohol in the stomach is also greatly reduced. So therefore, the blood alcohol concentration could be increased. So once alcohol has entered the bloodstream, it is then transported to the liver, where it is then broken down further. So hair testing measures the level of ethyl glucuronide, which is ETG, present in the hair. And ETG is produced by the liver when alcohol is consumed. So therefore, theoretically, it is possible that if more alcohol is present in the bloodstream, that the level of ETG would also be higher if a gastric band was not fitted, was not present. Okay. As I said, our area is in the expertise of detecting substances in hair. So it would always be recommended to contact a suitably trained medical professional just to confirm our understanding of how a gastric bypass could affect the ETG level, which is detected in the hair. Okay. Okay, so understanding some of the analysis results and some of the terminology that is used in the report. So the reporting cutoff level. So this is the level which is used to determine if an analyte is detected or not detected. So a result which is above this reporting cutoff level would be considered detected. Anything below the cutoff level is reported as not detected. And the reporting cutoff level can vary depending on the drug that is actually being analysed. It's not a set cutoff level for every single drug. It varies depending on the drug. Now, the Society of Hair Testing does recommend cutoff levels for alcohol markers and drugs to indicate the more repeated use of a drug. So the cutoff level is there to show the repeated use. One-off instances of drug use, for example, may go undetected because the level of drug actually ingested, incorporated into the hair would be very small. And it wouldn't be expected to fall above that cutoff level to show the repeated use. So we apply the cutoff levels recommended by the Society of Hair Testing where applicable. However, as I said, our experts are on hand to discuss the results with you and explain our interpretations and opinions should you require it. Okay, and then just to conclude, so we provide expert reports, analysis results in a market-leading analysis time of 4 working days on average. So as I said, if you receive a sample at the beginning of the week, you'll have the result by the end. However, we do recommend ensuring that the sample reaches our laboratory at least 5 to 10 working days before you need the results. This is just so that you've got sufficient time to read the results, absorb them, and ask any questions or clarification points of us prior to you having to file them or present them in court. As I said, the certificate of analysis is provided at no additional charge, and that can come as standard with all drug and hair alcohol test results. However, the expert report does offer you that extra interpretation and does provide case-specific information and may actually answer some of the questions that you may have if you just had the certificate of analysis. However, all of the results that we provide are legally defensible, whether that's a certificate of analysis or an expert report. And our experts, reporting scientists, can attend court to provide expert evidence if required. Okay, so that concludes today's event. Thank you ever so much for attending and joining us this afternoon. I hope you found it very useful. And as I said at the beginning, please, if you do have any questions, you can email them through to us at the email address which is on the screen, experts@lextox.co.uk. We will be hosting another webinar in due course. The details of the next event will be released shortly, and I hope to see you all there again. Thank you ever so much for your time today. Thank you.